government economic plan has been interesting in the context of utilisation of some of the funds from Europe and the EU Recovery and Resilience Fund, with particular focus on technology and also on the green recovery. From a green recovery perspective, there's a number of areas. I guess there's the Pathfinder project for energy efficiency, which is great to see some traction in that space, and there's also a plan for a low-cost loan scheme for private residential retrofits as well, which is certainly an interesting area and something that it's great to see quite a bit of traction on. Then from a digital perspective, there's been some good announcements in relation to investment in digital from a government perspective, so investment in a data centre, also some additional investment in e-health, which, as we've seen quite recently, it's certainly an area that needs significant infrastructure investment. And then 5G, 5G for government is a massive opportunity into the future, and it's great to see that government are finally talking about it and considering it in the context of utilising European funds. I would certainly see from some of the challenges that have been set out, I would say that there are areas that lack detail, and probably the two areas that are of most concern would be probably the more critical areas in terms of what we need to do, and that's in housing and healthcare. From a housing perspective, the plan does talk about acceleration of social and affordable housing, and also utilisation of the Land Development Agency to help facilitate that. That's one part of it. There's also a need for local authorities to get involved. There's a need to recognise the private sector's ability to be able to deliver housing as well. And there's a lot of blockages in that space that have to be addressed. Blockages around planning, blockages around public appeals, blockages around the actual delivery and structuring of how housing will be built and implemented, and even blockages around the construction sector and its capacity to build. So that's a challenge, and the plan probably doesn't go into that in enough detail. And then on the healthcare side of things, there are 3 projects announced that are part of the Sláinte Care programme. Certainly we would welcome that, and we would welcome acceleration of the Sláinte Care programme. A lot of what's in Project Ireland 2040 on Sláinte Care is at the strategic policy level, and it needs to start filtering down into the project level and actually into delivery. Recovery from COVID has taught us a lot, but certainly in healthcare, there's a need to invest a huge amount in our community care, our primary care, our hospitals in general, and to accelerate the Sláinte Care plan.